Thank you so much, Amanda, for the invitation. It's really great to be here. I've heard a lot about the Health Leadership Academy, and it's certainly in line with my vision of improving training at McMaster and in our community and our academic hospitals, improving training in a way that really helps the populations that we serve. Within the context of health innovations, I guess the innovation that I'm going to talk to you about today, please come in, is based on a personal experience. I won't be describing our scientific findings. I'm going to share a story with you that includes a bit of science that really changed my perspective on what I do as an autism researcher. So we're going to start by just briefly talking a little bit about autism. I'm going to describe my personal experience as an autism expert, and I use quotes quite intentionally. I'm going to describe a very brief pilot study that we implemented last year at McMaster University called the Job Training Program, or the JTP. I'm going to share with you a personal confession about how this pilot study actually changed my perspective as an autism expert. And then I'm going to provide some thoughts about moving forward in terms of autism research and autism training and care. And hopefully we can keep this informal and have a conversation. The first line on my slides is one of my preferred definitions of autism. There's more technical definitions in the Diagnostic and Statistical Manual, but this is one that is provided by Autism Ontario, which is an advocacy organization in our province. So autism is a complex, lifelong neurodevelopmental disorder or condition that affects the way a person communicates and relates with the people and world around them. So I think it's a rather general definition that allows us to have a conversation. Autistic tendencies can be seen in all of us. There's a new theory out there related to what's called the neurodiversity that presents this perspective that autistic tendencies can be seen in all of us as part of human variation. But in some people, they're more severe, and in some cases, they're impairing. And although there's different estimates in terms of the rates of autism, I would say that using the 1% rate of prevalence is probably a safe way to go, at least for this conversation that we're having today. And of course, the impact of autism is far greater if you think about how it affects families and communities in our province and in our country. So a bit of personal experience. So I first encountered autism when I got a research assistant position at McMaster University approximately 15 years ago, in 2002. At the time, I was coming out of graduate school with a psychology degree that was heavily focused on mental health. But autism at the time wasn't part of the curriculum. So I knew almost nothing about autism other than the stereotypical image that we get from movies. So I started reading the scientific literature, and then I went through training at McMaster and at the Hospital for Sick Kids on how to assess and diagnose autism. And my specific role back then was to recruit families into a new study that would follow diagnosed children over their life course. That study was still called the Pathways in ASD, and I will talk about the study in a few minutes. So through that initial experience, I quickly realized that every child with autism was different. And if you think about it, every child, neurotypical child, every child is different. So why shouldn't every child with autism be different, right? But we tend to think that when a group of kids or individuals share a label, that they're pretty much alike, right? So this idea of autism heterogeneity became the focus of my program of research, and we can talk about that today or another day if you wish. That's not the focus of why I'm here today. But my experience with children and families back then, and for the past 13 years, I would say, was pretty structured, and in many ways, pretty limited, right? We had the research protocols that guide how you interact with these children and with these families. And most of our research was focused on young children with autism. So this idea that autism is a childhood disorder, but we know that autism is a lifelong condition. So again, I was gaining experience, but it was pretty structured and pretty limited. So I will now play a very brief video describing the pathway study, just to give you an idea of what our research focuses on.
Hi, my name is Sarah, and this is my husband Ed, and our son Ben. Ben was diagnosed with autism spectrum disorder, or ASD, when he was 4. Around his 2nd birthday, I had started to wonder why he didn't notice when I called him, or look when I pointed out things to him. He wasn't interested in playing with other kids, but he did like to line up his toy trucks. A lot. That and spinning their wheels. I was concerned, so Ed and I took him to our pediatrician. That's when we were first told that Ben was on the autism spectrum. We were devastated. We really didn't know much about ASD, but soon were overwhelmed with the amount of information coming at us. I was confused and upset and uncertain. If you have a child with ASD, you know what I'm talking about. We quickly learned that it's very hard to paint a picture of how each child with ASD will grow and develop, or to know what things predict how well they'll do in the future. And that's what we were desperate to know. We would do anything to help Ben live a happy, healthy life. Around the time he was diagnosed, we heard about a new research project underway in several cities in Canada called the Pathways in ASD Study. We'd never taken part in research before, but we wanted to learn as much as we could about ASD. The research team explained that they were going to follow a large group of children with ASD from around the time of their diagnosis until they entered school. We were told that doing the study this way helps to track and better understand how the symptoms of ASD change over time and what things might affect children's development, for better or worse. This is the sort of thing we wanted to know, and taking part in the study might help others too. And I was proud to learn it was parents and other people whose lives are touched by ASD who came up with the idea for the study. The Pathways in ASD study has been set up in phases, with the first following Ben and over 400 other preschoolers from when they were diagnosed until they started school. Phase 2 then followed the same children, Ben included, from age 7 to 11. Every year, the Pathways in ASD team checked Ben's ASD symptoms and his daily living skills and behavior, and asked us how we're doing and our opinions about Ben's condition. Each time, they also asked about his treatment, his school, how we were doing as a family, what kind of services we were getting, and what community programs were available. The Pathways researchers reported what they've learned to us and to other researchers and clinicians. They said it's clear from their work that children all develop differently, and that no one should try to predict how a child with ASD will do in the future based on how they seem at diagnosis. For instance, children's ASD symptoms and their everyday skills change at different rates. We also learned that treatment should be based on each child's needs and changed as needed as they grow up. I'm happy to say our family just enrolled in Phase 3 of the Pathways in ASD study. We are curious to know what the researchers will find as the kids become teenagers and what sort of things might help them develop and become more independent as they get older. One thing I know for sure, ASD is not a life sentence to one way of being. It is ever-changing. With patience, understanding, and hard work, we can achieve some good outcomes for Ben. I believe the information coming from the Pathway study could help people understand what improves life for those with ASD and for their families.
Okay, so hopefully that gives you an idea of one of the largest research projects that we're working on, the Pathways study that is led by Dr. Peter Zapmari, who's also my mentor. And I'm happy to say this is a national study. It's the largest study of its kind in the world, and the core site for this study is here at McMaster. So this is a kind of the conventional way of doing autism research. Now, remember, these kids were recruited into the Pathway study almost 15 years ago. So all of them are now teenagers, and they're getting ready for that important and challenging transition from school into the workforce or into, as some people say, the real world, right? So the big question right now, especially for parents, but also for clinicians and researchers and policymakers, is what does the future look like? Most of our expertise and most of our experience is with autism as a childhood condition. So the big question is, what happens to these kids when they grow up, when they become teenagers, when they become young adults? So a couple of weeks, I came across a very powerful perspective piece in the New York Times. How many of you have seen this? Okay. So as I was preparing for this talk, you know, I was wondering, how can I make this message clear? And then I came across this article. This was written by a mother of a 20-year-old with autism, and it's called Looking into the Future for a Child with Autism. And it really shows how no matter what parents initially think at the point of diagnosis, no matter what clinicians think at the point of diagnosis, no matter what scientists have in mind for children with autism, it is very difficult. And in many cases ends up being surprising in predicting autism trajectories as these kids grow and develop. So I'm going to read a paragraph from this article. And again, this is the mother of Ethan, a 21-year-old with autism. I wish I could tell other parents at the start of their journey what's taken me 2 decades to learn. First, that your child may continue to grow and change, and even at the age of 21 may surprise you by doing things you never thought possible. Second, that in the end, success will not be measured by academic performance or job placement. It will have more to do with accumulating the small pleasures and filling your life with those. I don't know why it never occurred to me your future should look like the best parts of your present. I personally found this extremely powerful, and it really helped me formulate the way I think about autism moving forward. So, going back to this idea of transitioning from school into adulthood, the Canadian Alliance for Autism conducted a national survey a couple of years ago trying to identify what the priorities are for families affected by autism. And one of the top priorities that was identified was preparing youth for the major life transitions, specifically employment, so finding and keeping a job. We know from the limited research that's out there that unemployment rates in adults with ASD or autism range between 75 and 90%. So if you think about it the other way around, only 1, maybe 2 out of 10 individuals with autism end up getting and keeping a job. So this idea of transition as a given point between high school and adulthood is probably not a good one. So our team, along with some collaborators from across Canada, are reconceptualizing the idea of transitions as a process that starts early in high school and moves into the early adult years. So we need earlier exposure and increased work opportunities for youth with autism. So a couple of years ago, we received a very small research grant. In fact, it was the smallest grant we ever received in our team's history. It was $76,000 from Autism Speaks Canada. Now, this was what was called a community grant, and it required the collaboration and partnership between an academic institution, that's us, a community organization, that's Woodview, and in this case, the public school boards in Hamilton. So we actually have Irene O'Connor here with us today, who played a major role in implementing this project. So the research team was led by a very bright young clinician scientist, Brianna Direze, at Canchild at McMaster. Robin Brennan is the director of Woodview. Irene O'Connor is here, one of our research associates. Sue Hanneman and Anna DiFazio are the public school board people responsible for the autism portfolio. Jeff Hall, Terry Bennett, and myself are at McMaster. So this was a small grant. It was a pilot project based on a 14-week evidence-based summer program that included a group session with coaches and facilitators that provided both individualized and group support. But most importantly, it included a paid summer placement, a 9-week paid summer placement for youth with autism, right? So we got the grant, and then we had to actually find 12 placements for these youth. So we went across campus, knocked on doors, and said, you always said you support autism research. This is your chance to prove it. And you know what? The response of the university was amazing. We quickly secured 12 summer placements at housing and conference services within the health sciences library, the faculty services, across academic departments, and across 2 research centers. One of those centers is the Offutt Center for Child Study, which is where I'm based at. And we specifically had 3 youth join us for 9 weeks over the summer in a paid placement. And their tasks included, among others, data administration and other support for our research projects. So the overall program goals were to help youth develop a skill set that would enhance their employability. That's kind of a standard goal of any vocational or pre-vocational projects. The second one was to educate and support the parents themselves as they were navigating this transition for their child. And the third one was to enhance the employer's experience with ASD. So this is where I come in. So this was the first project in which I was a researcher and a participant as an employer, because I was a supervisor at the research center employing 3 of these youth with autism. There was a weekly job club. Some of the themes that were emphasized at these group sessions were stress management, problem solving, self-advocacy, giving and receiving feedback, relationships at work, job interview skills, personal preparation, self-awareness, something we can all benefit from. When we asked, so I'm not going to present any quantitative results from the actual pilot study. If you're interested in those, I'm happy to have a discussion after. I'm going to present some of the qualitative feedback that we received from participants. So when we asked the youth to give us 1 or 2 words that describe their experience with this program, this is what we get. So the larger the font, the more frequent this word by the youth, right? So learning, experience, it happens, it's good, it's rewarding, it's prepared, it's challenging, interesting, informative, right? Now, I did ask one of the youth that at our center to kind of in private, what did you think of the actual tasks that you were assigned to do at the research center? And he said, it was boring. Yeah. But then he said, but you know what? I get paid, so that's fine. Right? So feedback from the parents. This is just, again, selective feedback. My son is far more independent than I thought it was. Again, these expectations, parental expectations. I saw my child become more independent, take on more responsibility, and be excited to get up to go to work. I noticed a huge change in my son's level of responsibility. He sets his alarm, goes to bed without reminders, does chores at home, is out the door on time, and has improved his physical self-care and appearance. These are meaningful life skills for any youth. So this is where the personal confession comes in. So some of you are scientists, most of you know scientists, and you know that we usually like to be right. Right? So I have to confess that when these youth joined our research team as part of the job training program, I was nervous. I'm usually never nervous. I didn't really know how to interact with them. So this is someone who has been studying autism as a researcher, as an expert for 15 years. And as soon as I was exposed to these youth outside the structured, kind of limited protocols of our usual research studies, I became nervous. My voice was louder. You know, when you talk to your dad on the phone and he's across the country and his voice is loud because it's long distance, that's how I was. My speech was slower. And then I kept repeating my statements and question until one of the youth said to me, "Oh, you just asked us this question a few minutes ago," right? And then it really hit me. I was the only one in that group of people who wasn't being myself. So I made a conscious decision to just relax and just try to be myself, right? So I started interacting with these youth the same way I interact with all of the other students that come through our research lab. And then the interaction became meaningful. That is when my perception of autism stopped defining the way I think about autism and the way I interact with these youth and these families. A couple of examples that my definition of meaningful interactions, right? So I would start by giving them an introduction of what we do as a research center, right? And I would say, well, we do research on A, B, and C. And one of them asked me, but what is research, right? No other student. And I teach in one of the most prestigious McMaster, undergraduate programs. No other student has ever asked me what research is. I had to stop and try to define what research was, right? But we had a meaningful conversation. We used the example of video games, that youth specifically enjoy playing with video games. So we used the example of video games and tried to see how we can formulate a research question on which video game, is the best right now for that age group, right? It was a meaningful interaction. I then went on to describe a new project to them, and I used the word innovative. And he looked at me in a very honest way and said, "Do you really think that's innovative?" Right? So what we think is innovative, in most cases, is common sense, right? So again, these are lessons that I've learned through my interaction with this youth. So here's a note to self, and hopefully to you and others who want to make a change for these kids and their families. As we move forward, we need to move beyond the medical model of autism and disability. I'm not saying we should stop using the medical model, but we should not limit ourselves to this idea that autism is a medical disorder and that's the end of it. We need to appreciate variability in outcomes. Even if all these kids receive the same diagnosis, they all go on to grow and develop in different ways, just like any other kids, just like us. For clinicians and scientists, this might be hard to accept, but we need to accept our limitations in actually predicting outcomes. So the diagnostic process is a very important process, especially when it comes to identifying the needs and developing the treatment plans for the child, right? But it is very difficult to predict the future 3 years down the road, 10 years down the road. And I've heard stories from families who say, well, you know what? The diagnostician told me my son will not even finish high school, and you know what? He's graduating university. We need to rethink the outcomes that we consider important. So this was a major lesson that we learned through the pathway study. So in conventional autism research, you measure the usual suspects: IQ, academic achievement, behavioral symptoms, adaptive functioning. But the parents and the youth themselves introduced us to this idea that there's actually more meaningful outcomes that we need to be measuring, related to friendships, related to romantic relationships, related to loyalty. You know, nobody is measuring loyalty, nobody is measuring honesty, right? And that we need to include the individuals with autism and their families in the process of rethinking and redefining how we do research and how we measure outcomes. We should definitely note, identify the challenges, and try to provide support for them. But we shouldn't stop there. We should also look for strengths and talents and potential and build on that. And the idea here is that we need to see the person, not just the diagnostic label. And I'm going to leave you with this slide. It's a bigger slide. It's an idea slide. Most of the scientific papers in autism start with the prevalence rate sentence, right? 1 in 68 or 1 in 100. The second line is usually the cost to society is estimated at, and then they provide a very large figure, right? So I'm proposing that we need to change the conversation. Instead of discussing the cost to society, we should be thinking of investing in people. These are people. We need to invest in them. We need to identify their potential, build on their strengths, provide the supports and accommodations, and build stronger communities. And that's exactly what we're going to do as a group. Next Friday, we will be holding our second annual stakeholder symposium, and the theme for this year is rethinking autism training. If we have to change the conversation, we have to change the way we train the next generation of autism experts. And by experts, I'm not simply referring to clinicians or researchers or policymakers or educators. I'm referring to anyone who is interested in making a difference for these individuals and their families. And I'm going to end by thanking the children and families that have been participating in our studies over the years, our collaborators, the amazing team at McMaster University, including Irene, who is here, and our many, many sponsors who have been very generous in supporting our work over the years. I have listed 4 of our websites in case you're interested in learning more about our work, and I'm happy to stay around and have a conversation with you after this. Thank you so much for your time.